Now, how do we actually generate a differential diagnosis?
Knowledge is king. We need that baseline knowledge of disease. So, knowing the classic signs and symptoms of these diseases is necessary in order to spot them in a patient encounter. And that's what our training is for, to learn about conditions, especially the common ones and the red flag conditions we don't want to miss. But we can't learn everything all at once. So, this highlights the importance of ongoing learning to build up that knowledge bank of diseases. To diagnose a patient or land on that most likely diagnosis, we have to be able to refine our differential. So we prioritize our assessment by starting with the most likely possibilities. We also consider red flag or dangerous conditions we wouldn't want to miss. And if we still don't have a concrete diagnosis, then we typically evaluate for less common or rarer diseases.
This leads to the next question. How do we actually land on the most likely diagnosis?
Well, the 14th century philosopher William of Occam said, when faced with competing explanations for the same phenomenon, the simplest one is usually best. Meaning, we want to find the simplest, most likely unified explanation of our patient's presentation, which is right most of the time, but not always.
This principle in medicine is referred to as Occam's razor.
In contrast, the American physician John Hickam reminds us that patients can have as many diseases as they damn well please. Apparently, that's a direct quote from him. Meaning, patients do sometimes present with multiple diseases to explain their presentation.
This principle in medicine is referred to as Hickam's Dictum.
Patients may also, in fact, present with less common or rare diseases. So we have to be aware of all of these possibilities. For example, let's say we saw two trees that were blown down overnight. Applying Occam's razor to the situation would lead us to the explanation that the wind blew them down, right? That's the most likely possibility. But applying Hickham's dictum to the situation, maybe we think one tree was blown down by the wind, but the other was chopped down by a person.